Good morning. My name is Brita Allers, and this is my research presentation for 509B. I will be presenting information regarding an article titled "The Relationship Between Mother-Infant Contact Time and Changes in Postpartum Depression and Mother-Infant Attachment Among Mothers Staying at Postpartum Care Centers, an Observational Study." The article investigates the relationship between mother-infant contact time and postpartum depression. The study took place in Korea, and data was collected between February and March of 2018. This study tracked the amount of skin-to-skin contact, also known as kangaroo care, that was achieved and monitored postpartum depression using the Edinburgh Postnatal Depression Scale. Postpartum depression can have devastating effects on women, infants, and their families. I know this firsthand since my sister just had her first baby and is struggling with postpartum depression herself. I selected this research article because there needs to be more effective ways to decrease the risk of getting postpartum depression. Per the maternal newborn Jarvis textbook, women who receive proper treatment will recover from postpartum depression, but they grieve over the lost time with their infants. Daily mother-infant contact time has been related to a decrease in postpartum depression rates, as demonstrated in this research. According to the article, it is traditional for postpartum care in South Korea to be focused on the mother's well-being. Most of the care centers in South Korea are for-profit organizations that focus on the mother's postpartum body shape, skin health, and comfort. While important, these activities may distract the mothers from playing a key role in their child's care and forming a bond with them. With the mother's well-being in mind, most of the time child care is provided by nurses or nurse assistants working at the care centers. Infants usually stay together in the baby rooms and are apart from their mothers. According to a previous study mentioned in this article, on average in Korea, mothers spend a little over 4 hours a day with their infants, and only 1.3% of mothers stayed with their infants at all times while they were in the care facility or care center. Separating the infant from the mother decreases the amount of skin-to-skin contact and also may cause the detachment between the mother and the child. This can increase the risk of maternal postpartum depression while also negatively affecting mother-infant bonding. The mechanisms underlying the relationship between skin-to-skin contact, depression, and attachment are not well known, but they have been linked to oxytocin. The skin-to-skin contact between the mother and her infant activates sensory nerves and increases the secretion of oxytocin, which reduces maternal anxiety or stress and improves attachment. There is also evidence that skin-to-skin contact between the mother and her infant can decrease levels of cortisol hormone, which is often referred to as the primary stress hormone. There are several other studied benefits of kangaroo care, which include the increased attachment behavior, and mother's feelings toward the infant may improve as well. All of these things contribute to lower incidence of depression while using kangaroo care. Considering that traditional practices in South Korea do not generally incorporate mother-infant contact time, this research regarding the impact of kangaroo care on postpartum depression could significantly decrease the rate of postpartum depression seen in this population. According to the results of this study, it is highly necessary to apply various interventions at the care centers to increase kangaroo mother care time and thereby increase attachment and prevent depression. Per the Jarvis textbook Maternal Newborn Nursing, perinatal depression, which includes major and minor depressive episodes that occurred during pregnancy or in the first 12 months after delivery, is one of the most common medical complications during pregnancy and the postpartum period. According to that same textbook, postpartum depression affects 1 in 7 women, and maternal suicide exceeds hemorrhage and hypertensive disorders as a cause of maternal mortality. Postpartum depression often goes unrecognized because changes in sleep, appetite, and libido may be attributed to expected postpartum changes. In addition, women may not report these changes because they have been told that they are expected. Because it can be difficult to distinguish these symptoms, it is important for clinicians to ask the postpartum women about her mood and for the woman to be screened for postpartum depression. So previous studies on the effects of contact between mother and infant and the impact on depression rates focused primarily on skin-to-skin contact in premature infants. Previous studies have shown that skin-to-skin contact positively affects depression, but they have not shown the changes in depression over the entire contact time. So this study is aimed to investigate the effects of contact time on depression among mothers of full-term babies staying at care centers in Korea. This study also includes research on the effects of maternal-infant attachment. This was an observational study done in 2 care centers in the Republic of Korea. The population consisted of 101 mothers staying for 14 days in the care center. The study took place in February to March of 2018, and based on recommendations from the World Health Organization, kangaroo mother care was facilitated by specialists for 1 hour a day. Breastfeeding was recommended, but the feeding type was the mother's choice. A self-administered questionnaire was used to assess participants' general characteristics, depression, attachment, and contact timesheet. The Korean translated Edinburgh Postnatal Depression Scale was used. This scale consists of 10 questions on a 4-point rating scale from 0 to 3 points to assess the level of depression in the postpartum woman. Higher scores indicate more severe depression. For each participant, data was collected twice, once at admission and once at discharge. This study was approved by the Busan National University Institutional Review Board and was conducted according to the ethical criteria approved by that committee. Total contact time and average contact time were calculated. The means and standard deviations of total or daily contact time, depression, and attachment, and the amount of change between admission and discharge from the care centers were calculated. Changes in depression and attachment were divided into groups, which included decreased versus not decreased, or increased versus not increased. And their frequencies and percentages were calculated as well. The correlations between total contact time and change in depression and attachment were analyzed using Spearman's correlation coefficients. Multiple tests, including the Kruskal-Wallis test and the Mann-Whitney U test, were used to analyze and compare the data. The mean depression at admission was 8.76 points, which decreased to 5.3 points at discharge. This totals a decrease of 3.6 points over the 14 days, reflecting a decrease in depression. This study also showed that mother-infant contact had positive impact throughout the contact time. Change in depression was higher for more than 0.5 hours of daily kangaroo mother care as compared to no kangaroo mother care. Changes in depression correlated significantly with total feeding time, total kangaroo mother time, and total contact time. Depression at discharge showed a significant decrease, which may be related to both a natural decrease over time, as well as the influence of mother-infant contact. It is important to note that there were differences across the study according to the patient's age, marital satisfaction, emotions during pregnancy, and participation in the kangaroo mother care. There were several limitations of the study that I would like to discuss. Firstly, the mean daily kangaroo mother care that was achieved was 0.58 hours a day, which was less than the 1 hour a day that was recommended by the World Health Organization. Additionally, direct comparisons were difficult to make due to the differences in timings, participants, participation, and contact type. This study was comprised of 101 participants and done over a 2-month period. According to an article titled "Sample Size, How Many Participants Do I Need in My Research?" There are many factors that go into choosing an appropriate sample size for research. Without more information about this community, it is hard to determine if 101 participants is sufficient However, 100 participants is generally considered the minimum acceptable number for research. Up to a certain point, the larger a sample size, the more reliability that is associated with that study. And lastly, contact time for this study did not include maternal-infant interactions during diaper changes, baby massage, and self-motivated kangaroo mother care. The contact time included in this study was limited only to the 1 hour of supervised time per day. Therefore, contact time was likely underestimated. It is important to implement mother-infant contact time because this study has shown that it can decrease postpartum depression and it promotes mother-baby bonding. As previously discussed, postpartum depression affects many women as well as their infants and families. There needs to be more interventions to decrease the rate of postpartum depression. Increasing mother-infant contact is a great non-pharmacological option. This intervention can be implemented into nursing practice by educating the women and family about kangaroo care and the previously described benefits of skin-to-skin contact. This can be done while in the postpartum unit. Supervised kangaroo care is appropriate to continue to teach the mother and family how kangaroo care should be performed and further discuss the benefits. With this knowledge of how to perform kangaroo care, as well as the reasons why it is important, this mother should be equipped to continue kangaroo care once she has gone home. The mother should continue to be screened for postpartum depression, and this can be done in the hospital and then followed up with outpatient by her provider. I do have several recommendations for further research related to this topic. Future studies on the relationship between contact time and postpartum depression should consider all types of contact, including bathing, diaper changes, and baby massages. My solution for this problem would be for the mother to record contact time instead of requiring supervised kangaroo care. This would allow for additional forms of contact to be considered. I would also recommend a larger sample size to increase the reliability of the study. The sample size could be increased by expanding to additional healthcare facilities and enrolling additional members. An incentive might encourage people to enroll in the study. Lastly, I would also recommend a longer duration of research. This research took place over 14 days directly postpartum. However, according to the Jarvis Maternal Newborn textbook, postpartum depression can occur within 6 to 12 months of giving birth. Therefore, a longer clinical trial would better indicate whether mother-baby contact has an impact on postpartum depression in the long term. My solution to this problem would be for the mother to continue recording contact time once she has gone home. Once a system of self-recording is developed while in the hospital or care center, parents could then continue to record the mother-baby contact at home. In addition, the Edinburgh Postnatal Depression Scale could be monitored by the mother's provider on an outpatient basis. In conclusion, postpartum depression is a serious complication that affects women, their infants, and their families. This research proposes that mother-infant contact time has an effect on the rates of postpartum depression, and the results show that an increase in mother-infant contact time correlates with a decrease in depression. Therefore, kangaroo care should be implemented in nursing care to decrease the rate of postpartum depression. Kangaroo care should also be maintained once the mother and infant go home, and the mother should continue to be monitored for postpartum depression as an outpatient. Thank you very much for your time. Here are the references I used for this presentation.